Hi, everyone. Ready to dive in? So we don't have a ton of updates today. We're up to 30 confirmed cases. And it's important to note that 43% of our cases are of 25 to 49-year-olds. So it's a big chunk of the positive cases are middle-aged folks. Also wanted to give an update on the Bella Vista residents. So as of yesterday's press conference, we were told that the individual would be returning to Bella Vista. In the end, the individual has stayed at the hospital and is still at the hospital. So currently the individual is not in self-isolation at Bella Vista. The individual is at the hospital. Couple other updates. Home Depot donated 100 masks, N95 masks to the fire department. We're very appreciative of that. We've gotten a number of complaints about grocery stores and bodegas not promoting social distancing. It's obviously challenging within a store to facilitate that, but we've seen some successful cases where stores will limit the number of people that can go into the store to help make sure that people are social distancing. And we're asking our friends out there that run different grocery stores to ensure that they're implementing policies to promote social distancing. And our police department is also going and reminding stores that they need to do that. We've also seen some indication that nail salons and barbershops and tattoo parlors, some of them are still open. So again, we're asking people to make sure that they're practicing social distancing so that we can reduce the speed of the spread of the virus and protect residents. And that's a responsibility of everyone in the community to do. I have just two other updates. There was a shooting on Monday that has been reported in the press. Unfortunately, that individual has died in the hospital. Initially, the individual was stable, but the case took a turn. And so this is I believe our second homicide of the year. Chief Reyes is on the call to answer any questions. Obviously very disappointed and sad for that loss of the member of our community. And there was also a suicide this morning. We don't have yet a lot of details to share with the press, but again, Chief Reyes is on the call if there are any questions. Director Bond, do you have anything that you would like to add? No.
Not at this time.
Chief Reyes, do you have anything that you'd like to add at this moment?
No, sir. I'll answer questions as they come.
Okay. Are there any questions? Shana.
All right. Hey, Mayor. Thank you so much for taking my question. If you can just walk us through one more time the Bella Vista, or maybe Director Bond can, the Bella Vista resident. Can you just kind of walk us through from beginning what happened and where they are now, just so we have a clearer picture? I think we have a lot of information coming at us, so we want to make sure we kind of have the right timeline of events in regard to this particular case.
Yeah, absolutely. So the case in that particular facility was presenting some symptoms, was transported to the hospital the day before yesterday, was tested positive. They were anticipating that a discharge to be scheduled for yesterday. And so we were updated and reported that that is not the case, but is stable. So being closely monitored at the hospital at this time, and we will continue to monitor when the discharge arrangements will be, so that it can be a smooth transition into the unit.
Gotcha. And I don't know if we touched on this, I believe we did, but just kind of to refresh our memory, the precautions in place at Bella Vista, what has been done so far in light of this case?
Prior to this case, and in addition to this case, there's been an entire protocol that has been executed from the facility. They presented those protocols to both the mayor and myself. They have posted signs in every single tower. They have 5 towers and 2,000 residents. They have, provide facilitated restriction of visitation to essential individuals that need to enter the facility. They're doing daily calls, just to do well-being calls to check on individuals. identifying needs, and just seeing if anyone is presenting any symptoms so they can assist them to get to care. So they've done a great job in that. They've identified some of their basic needs of individuals. We are working closely with them to providing that assistance so that they can ensure that they have that access.
Thank you. I have one more question for the mayor.
Yeah, I'll just add one more point to that. They've had a little bit of difficulty. Most people are abiding by the visitor rule, but some are not, and so we're in conversations with them to see if there's ways that we can help facilitate them having a little bit more of an ability to restrict visitors to the site. As many people have seen in nursing homes in other cities, there's been a huge impact in the number of unapproved people visiting the site can increase risk, and so we're trying to work with them on that.
Gotcha. Now, Mayor, Yale University, obviously, I'm sure you've heard, has canceled their commencement this year with regard to COVID-19, and I'm imagining this is an economic blow for the city. I mean, what kind of steps are in place? Are any conversations being had with the amount of revenue loss that's expected to really hit the city in the next couple of months?
I think this is one of many examples where the city is being hit hard economically. I know that Yale is looking at ways to support businesses in New Haven. They have a significant impact on businesses because many businesses rent from them. It's not just the commencement, but many other businesses are really struggling. We were happy to this morning have another press call about Together New Haven and our collaborations with the state of Connecticut to introduce loans that would be forgivable. Mike can add any details on that. Or the federal government loans, my understanding is if they increase or they keep employment, that they will be forgivable as a gap, and the state is also providing some subsidies as well.
Gotcha.
Mike, I want to make sure that I just shared accurate information. Can you confirm what I just said is accurate?
No, you've got it. And we can point anyone on this call to a presentation deck we did today where we organized both the federal and state programs.
Thank you.
I noticed that Tom had a question.
Thank you, Mayor, and thank you all. Director Bond, you mentioned yesterday that you all were doing some pretty intensive contact tracing for the man who unfortunately passed away from COVID.
Yes.
Could you speak a little to anything else you can share about that contact tracing and about you said the people that he may have been in contact with?
Yeah, so we're doing daily monitoring and checking temperatures twice a day. So we're working in partnership with the system as a whole. And so we are closely monitoring that daily. And so we are on top of that and making sure that if anyone does present any symptoms, that we ensure that they are, get tested. And so so that's the most recent report on that one.
And could you speak a bit about, besides conversations with Bella Vista, any other conversations you've had with places like the Towers or Mary Wade or other senior living facilities about how best to protect those populations?
Yeah, absolutely. So about a week and a half ago, we had a webinar for all of those type of facilities with subsidized housing individuals and also nursing homes, just to ensure that we provided education and recommendations on how to best safeguard their residents and their patients. And then we provided them resources as a follow-up. We also posted what you need to know and those slides on our website. So that's all of it made available publicly for them. And so we continue to, if there's any facility that we have a concern of, we do follow up just to see how what they need for us to provide any support. And so, yeah, so we've done some efforts in ensuring that they are aware of those recommendations. A lot of different facilities have taken proactive steps to safeguard their patients or clients.
Tom, just to add to that, we did have, I think Bella Vista is a little bit of a unique case. The Towers has much more of an ability to restrict access because there's one entrance that is monitored 24/7 by someone at the front desk. Bella Vista is more of a scattered site. There's a lot of people driving and walking on site into many different entrances. And so, and in addition to that, the number of people that are living at Bella Vista, it's over 2,000, I believe, just elevates our level of concern for the site. And so we've been spending, we did have a conference call with Bella Vista, the Towers, and the Housing Authority a while back to talk about what they're doing to prepare, but we have particular concerns about Bella Vista just because of those attributes.
Mm-hmm.
Thank you. And if Mayor, you could give an update on the career shelter that is being prepped by the city.
We have consistently found it challenging to identify staffing. And part of that is on our side, getting the system in place to allow us to activate people. We're hoping that we can, we'll have some announcements in the coming days, but we don't have any major updates right now. Trust me, I wish I had an update for you because we're very anxious to get this site online.
I have a few other questions, but I'm happy to defer for a little bit.
Anybody have a question? Let's go to Kyle. Go ahead.
So I know that you just talked a little bit about the partnership that you
Can't hear you. We can't hear you.
Oh no.
You're like distant.
Oh.
Can hear you a little bit.
Any better? No.
Well, it's very quiet. So if you just shout, maybe we can hear you.
Okay. I'm sorry. What's the partnership like working with private companies like Bella Vista to try to make sure people are safe? I know you listed the things that they're doing, but does it seem like they're able to do enough? I know if it's a city facility, you might have more leeway with them.
So the question is, what is the partnership like with private companies such as Bella Vista? Is it different than other places where, you know, in the city we have control over our own operations, say? And I would say in general, this is the case with a lot of different partnerships. You know, we're partnering with the hospital, with Fairhaven Health Clinic, with Cornell Scott, or Fairhaven Health Center with Cornell Scott, and with many of our other private nursing homes that are operate around the city. By and large, everyone is concerned about the health of their residents and being very proactive on how to make sure that we work together to address the public safety needs. I also think it's important to note that in any type of partnership, there needs to be a lot of trust building and conversations to make sure that we address any needs that come up. And an example of that was the work that we've done in the last several days to improve the hospital's ability to make sure that if there is someone that's a flight risk, we are able to catch that issue before it gets any worse with the individual that left that was COVID positive. So on the Bella Vista side, we've been spending a lot of time having conversations with them about ways that we can help them, ways that they need to take a responsibility as well. And in general, they've been very, very collaborative. Before I go back to Tom Breen, anybody else have any questions here? Go back to Tom.
This is a question for Chiefs Alston and Reyes, if they're available. I got a question from a reader asking about the latest with any academy classes for police or fire. Are there still people being trained and potentially newly hired, or are those put on hold?
So currently we just had, thank you for the question. We just graduated a class that was put into service a couple of months ago. And so the academy staff now has been switched to a logistics staff to support the mayor's incident team, unified command team for the emergency. So there are no plans of us staffing that currently. And of course, by not doing that, that is going to have an impact on us financially because we'll be using overtime. So.
Chief Reyes, I don't know if you want to add anything there.
I do. I was speaking, but I forgot to unmute. Thank you for the question, Thomas. Yeah, it's, as you know, for us, we are in the process of conducting background investigations on prospective recruits. That is continuing to happen. Obviously, we are being as careful as we can be and applying social distancing, but we are still able to carry out many of those functions. Several of those individuals are going through polygraph testing and other other background procedures. So while we anticipate that there might be a delay in the start of our academy class, we are prepared to start a virtual academy if need be.
Thank you both.
Yep.
I also wanted to ask Director Bond if she could share anything about the one new COVID positive case since yesterday. I believe the number went up from 29 to 30, if I have that correct. Is there anything you can share, Director Bond, about their current condition and whether they're hospitalized or not at home?
So that current case just came in this morning, later this morning, into our system. We are going to be conducting contact tracing, but what I could tell you is an older individual in their 80s.
Thank you.
Absolutely.
Then my last question is for the mayor. There have been some pretty shocking reports by the New York Times about conditions at Elmhurst Hospital, in particular, in Queens. And I wonder if you've been reading about just how completely overrun some New York City hospitals are, and what your latest conversations have been with Yale New Haven Hospital about conditions there and how to prepare for potentially similar conditions.
I have been reading about it. Usually after I'm done with work late at night, I pick up or I look at the New York Times, and there's been some pretty concerning articles about what's going on in New York City. That I think that one thing that we're fortunate in Connecticut right now is by seeing what's happening in other places, we have a little bit more time to prepare. I know the hospital is working very hard to identify and clear more beds for increased capacity. I also know that the state is working to turn their attention to identifying and preparing overflow sites for more hospital beds. And I'm confident that we'll see more news in the press about that soon, of the state's effort to make sure that we're able to respond to the capacity issues. But it's not just beds. I think one of the main challenges is the staffing. And the second challenge is equipment. And obviously in New York, we've seen, in addition to a dearth of PPE ventilators, that's a major, major concern. My hope is that in addition to the state working hard to prepare for this, that the federal government takes a more proactive role in ensuring those communities that need ventilators now get them now, so that we are able to share with other communities that are hit later the ventilators that we may have with them later on. We're going to have serious, serious problems if we don't very proactively respond and prepare for the spike.
And well, if I could sneak in one more question for you, Mayor. Again, I don't know if you've had a chance to read much about the third relief bill that was just passed by the Senate, but if you have, and if you've had a chance to digest a little bit of it, what do you think, and what do you think of the potential impact for New Haveners? I know there's a lot in there about direct cash assistance, about small business support, but do you have a big takeaway as you watch that work its way through Congress?
I haven't taken a look at the details. My understanding is that there's significant support for unemployment benefits, which I think is critical for our community. And some of the unemployment is tied to, or some of the business support is tied to businesses continuing to pay their staff and incentivizing businesses even to rehire staff that they may have laid off. All the wisdom around this virus is that we will get over this at some point, and get back to normal at some point. And so we need to provide that bridge of support, not only for our businesses, but for our community members, so that if we don't have that bridge, the economy will suffer so much more because people will be out of work and will have much more work to rebuild. So the federal government, by providing that bridge, will allow us to get through a very difficult time and continue running, land on our feet and continue running once this is over. And my sense with this, the federal package, is that it is working to address that very challenge that we're facing now.
Thank you very much.
Any other questions? Shana.
Mayor, have you had any conversations with just public transportation officials as far as the use of the buses in town? I know that people have not been using them as much, but people are still using them to get around. And I know that's a major concern as far as social distance goes and just curbing
I
the
actually
spread.
had someone from the state sent me some interesting statistics a little while ago, and I can read them to you.
Sure.
So MNR, is that Metro North Rail? That right? MNR ridership is down 95%, which is remarkable. Bus ridership is down 50%, and car traffic is down 43%. It's anecdotal, but I look out my window from time to time and see a lot of buses lined up on the green, and almost nobody is on the buses. And of course, that's disastrous for the economy, but that's exactly what we want to happen right now, because people not interacting with each other is critical to us overcoming this virus. So while it's challenging, it's also a really good sign that all of the ridership and usage of our public transportation system is significantly down.
Gotcha. Have you gotten any word on homeless shelters and kind of where they stand as far as capacity and what you plan to do with that vulnerable population at this time?
This is such a hard challenge, and much of our days are taken up by trying to address this question. And there are more people that are in need now for a variety of reasons. One of the challenges that we're facing is that homeless shelter staffing is down by 30 or 40%, because their staff, for a number of different reasons, are not able to report to work. And so in addition to there being more of a strain on the resources that we need to provide, because we want to decompress the shelters, spread out people, and that requires more staffing. On top of that, we don't have as much staff to support this. The state is also concerned about this. We just received some communication with the state Department of Housing that's working to help support the decompression of homeless shelters across all of the state. They're also promoting hotel rooms to serve as a way to separate homeless individuals from each other, because I think many of us understand that that is a weakness in our ability to promote social distancing. And so we're all working very hard to address that challenge. It's very complicated, as you can imagine.
Yeah. And you mentioned, I think the last time we spoke, maybe last week, you had mentioned that the city in New Haven had about, and correct me if I'm wrong on the number, did you have between 30 and 40 hotel rooms prepared for those? Or can you kind of speak to that number, and has that number increased since the last time we addressed it?
My understanding is we have 84 individuals in hotel rooms, and that's a mixture of the state program and our own program. I believe the city has 24 hotel rooms, and we have 2 people per room, so that's 48 people. And the state has additional rooms to bring us up to that 84 number. It's possible that that number may change, and all of those individuals are asymptomatic for COVID-19.
Roger. Thank you, Mayor.
You're welcome. Any other questions?
Mayor Kyle had her hand up before.
Oh, I'm sorry about that.
Unmute yourself, Kyle.
There you go.
Okay, no problem.
Oh, we can hear you so well now.
I took the headphones off, so maybe
Nice.
that was it.
Yeah.
I had 2 questions. So one quick question is, someone posted on Facebook a video of a bus, a New Haven bus, and it was all roped off, and the cover there was plastic over the little place where you put your card. Is that the case? Are people getting on the back of the bus? I was just wondering how that worked when I saw that. Are people getting on the back now, or is it free rides? How's that working?
So my understanding is that they're only allowing people to exit and enter the bus on the back.
Okay.
You might want to confirm that with CT Transit, but that's what I had heard from someone that reported some of the changes to CT Transit's procedures.
Okay. And then the second question was, now that we have 30 cases in New Haven, maybe Director Bond can go through kind of what is involved in contact tracing. And I know that it's a valuable resource, but is there going to be a point where contact tracing becomes difficult if we get to, say, 100 cases or something of that sort?
You're on mute, Maritza.
Sorry about that. You raise a great question regarding contact tracing and the ability as the numbers continue to increase. That is a challenge that we talk about daily on our calls with a number of public health leaders and healthcare professionals who have a vested interest in trying to mitigate this as much as possible. We are looking at ways to expand our contact tracing because we know that the only way that we can flatten the curve is that if there is the executive order continues to remain in place, people remain in self-isolation when they are exposed or sick and positive with COVID-19. And so contact tracing allows us to continue to allow that identification and isolation phase. And so it's still critical, and we are still going to continue in this phase until we continue to evaluate our daily numbers and efforts and trying to get recommendations both at the state level and federal level. So right now we are closely looking at that and of course looking at the shift in the data and where we are in comparison to others. And of course, New York is one state that we should be looking at, but we're also now looking at Boston and how that's evolving there so that we can be prepared in our efforts.
I think a lot of this is about limited resources and how we allocate them. And at different times during the phase of any community's experience with the virus, the response is going to be different. And to give you another example, we're talking about, do we really want to push more testing? And contact tracing and testing are generally important things that you want to do, right? But we have very limited PPE. And the more we test, the more we use up our PPE, and the fewer PPE that healthcare providers, doctors, and nurses in the hospital have. And so if we have very limited PPE, we might choose for a period not to do as much testing so that we can protect our healthcare providers while we go through the peak, whenever that may be. And then after the peak is over, or should our PPE get replenished, we might turn more back to testing because we have the capacity to protect the test workers as well as the hospital workers. So similar to contact tracing, ideally we would be tracing people whenever we get them, but we have a limited number of staff that may need to do other things if there's more urgency in other areas.
Okay, yeah, that makes sense.
Yeah, so we assess it each day. We're looking at this obsessively.
That's a better summary than my lengthy answer.
Okay. Thank you.
Okay, is that good, everyone? All right, thanks so much for joining. We'll see you soon.
Thank you.
Take
Bye-bye.
care.